Most of the public are not aware of palliative medicine, and it's not easy to convince the public to give up the curative options. So we need those people who treat them to tell them, say, this is beyond a certain point, now you may need to go for palliative care. Most of the cancer patients also do not know that such a thing as palliative care exists. So they end up in the hospitals to continue curative treatment to the point of no return, even to the last few days and weeks of life. In our curriculum, basically, when we were taught morphine, it's said as a narcotic. First and foremost, we'll have to improve awareness among the medical community, especially the youngsters who are coming out through medical curriculum, as well as conduct awareness campaigns in hospitals, medical colleges, etc., even nursing schools, colleges, etc. The patients, once they get into a stage where the pain is becoming unbearable, they believe any medicine should be given so that my pain is controlled, and their primary aim is to get the pain under control, not worry about the consequences of morphine. But the caregiver is really worried because they are worried that the side effects are going to come in. What if there is a major side effect? What will I do? Actually, if you use morphine judiciously and correctly, there is no such thing as respiratory depression, sedation, etc. This can be best avoided if you do it judiciously. As far as the layman's point of view, there are two ways they look at morphine. They're prejudiced. The reason being that one is that morphine is given at the end of life. So we don't want to start on morphine because I don't believe my relative or my loved one is actually at the end of life. So there's a denial aspect there. The second thing is morphine is it's a narcotic, it is a sedative, it's addictive. These are known to the layman also. So there is already a prejudice against morphine being used as an analgesic, which is what we do. Actually, we have to tell the layman or the public that you can use morphine safely and it's okay. In this kind of patient, chronic ill patients with life-threatening illnesses where they're in the last few days or months or weeks of life, morphine is one of the best drugs that can be given.